Good evening. Welcome to Prime Time with Faisal Rashid. Today we are talking about some medical issues the whole community face. I have a really nice guest today who is a doctor and consultant, and we will be introducing to him and we will talking about stem cells, how they can help to deal with diabetes, kidney problems and Alzheimer's. Let's welcome our guest today, Dr. Q, and we will hear some really inspiring information from him. Welcome, Dr. Q.
Thank you very much.
Dr. Q, why we call you Dr. Q? Could you please explain?
In fact, I used to do program on Fashion TV and DM Digital. It used to be, now they have relaunched. I'm glad to be here. This is my mother TV. My name is Dr. Qazi. Qazi is from Q. Q is Qazi. Q is quality. Q is Quetta. And Q is for cosmetics and Q is for cute. So people,
you look very cute.
So people, they say, but cute and cosmetics are from C, but in my case, they are from Q.
Okay, brilliant. That's great. Would you like to tell the audience a little bit about your background, about your education, about your history, and what you are currently doing and what you specialize in?
Okay, I've qualified from Lahore, from Allama Iqbal Medical College, Lahore. And then done my surgical training. After my master's in surgical training, then my fellowship part 1 from Royal College of Surgeons of Edinburgh. Then I've worked in different fields of medicine like orthopedics, and then I went into ops and gynae. I've done 3.5 years, 3.5 years of ops and gynae. I've done my primary fellowship of MRCOG as well.
Wow.
And then I went into GP training, and then I was a medical advisor for the government for Departments of Works and Pensions. I was a disability analyst.
Wow.
And then I became a UK police surgeon. I worked for Greater Manchester Police, for Lancashire County, for Merseyside County, for different counties I've been working. So I've recently finished that job. Then I was in cosmetics since 2000, and I introduced in 1998, 99, I introduced non-surgical solutions. So anything we could do, the cosmetics with surgery, I could produce it without surgery.
Without surgery, non-surgical.
With lasers, with different things. So my specialty is I manufacture and I advance in lasers. And after that, I've been into anti-aging and I've been into age reversal. So I was into regenerative medicine since 2002-03, because regenerative and aesthetic medicine. I've been working in that, and alhamdulillah, I've been taken as one of the authorities in stem cells, alhamdulillah, in the world.
In stem cells?
In stem cells.
Okay, very good. Audience, what a great experiences here with us today in the studio. Who has done extremely well in surgical and then non-surgical, and then he's been working, he's qualified in Edinburgh University, and then he's worked in, Merseyside Police and disability and all that sort of thing. So this is really great example of the people in this country doing so well. And this is the main idea for me, to bring all those kind of people on this platform and create that awareness, with the audience, and explain what they are all about and what they can actually do to help the whole community in the United Kingdom. So I'm really pleased to see such a great experience we have in this studio today. And what we are going to discuss today with Dr. Q, who is quality and cute, and also a consultant with Q. It's quite distinctive, so really pleased to see, what you are all about today. We discussed before the program that what we are going to discuss, because he's got a so vast kind of knowledge and experience, it's going to be very difficult for us to actually and complete and discuss the whole issues in one episode. So perhaps we will do 2 episodes with Dr. Q. And starting with today, we are going to just discuss with kidney, information about kidney, how you deal with that in stem cells. And diabetes is very, very big problem with, especially in Asian community as well, because with the kind of food and the kind of living style we have, and then Alzheimer's. These three aspects we will discuss today, how you can actually minimize and what you can do to deal with them. Is that okay with you, Dr.
I think Faisal, what we'll do is first let me explain stem cells. What are the stem cells and what is regenerative medicine?
Brilliant.
Because so many people, including a few of the GPs, most of the doctors, they don't have a clue about stem cells. Recently, I've had an experience with the GP surgery of my friend. His son had some problems, and I've recommended. Not recommended. I say, well, if you get on with these things in UK and exhaust all your medical things, then you read about it, the stem cell, the future of it, because he has got some peripheral neuropathies.
Yeah.
He's got a strange kind of a disease where his both lower limbs are, he's a very young boy, young boy, but he is paralyzed from, body below. So doctors haven't got that clue. So I will try to explain this in very simple, like a layman.
As a layman, yes, absolutely, yeah.
Stem cells, we were born with the simple single cell. A sperm came and it has joined with the ovum of a mother, and this made a zygote. Okay. So there was a single cell.
Zygote.
Yeah, it's called zygote. When they unite together, the sperm and the ovum, when they unite together, so when they fertilize, that is called a zygote. So that goes and attaches itself to the womb of the mother.
Okay.
From there, it takes nutrition and everything and starts growing. Okay. So this was single cell. Then it grew big and big and big, and slowly, every part was distinct. You say, if you see, the hair are different, eyes are different, skin, nose, teeth, tongue.
But it's the same
brain.
cell which is
So
growing.
The same cell. So what was that? This was stem cells. Okay. So basically, if I tell you in a nutshell that, a tree, a tree has got roots and it has got a stem.
Yeah.
And then it has got leaves, branches, leaves, and fruits or flowers and stuff. So this, if you cut the flowers, if you cut the leaves, if you cut the fruits of it, they will regrow again. Every year or something.
Every year, yeah.
So that's called. But if you cut the stem, then it's not going to grow again.
It's not going to grow, yeah.
So these are the stem cells which we have got in our body to do all the repair and stuff. When the child is born, there's any kind of disease, there's any kind of trauma, there's any kind of injury, there's any kind of disease, damage or dying cells. What stem cells they do, they are abundance when a child is born, So, so they go and repair it. So with the age, because our wear and tear is going on, when we reach 25 or something like that, if everything is okay, means the hormonal things and stuff, so we become depleted in stem cells.
Okay.
So that's how we become aged and we become diseased. So these stem cells are the basic blocks. What they do is there are two functions of the stem cells. Number one is that it goes and replaces the damaged, dying or diseased cell. So there's a cell which is damaged, diseased and dying cell. Body is made up of organs.
Yeah.
Different organs make a body, and organs are made up of cell. The primary component is a cell.
Yeah.
So when it is damaged, diseased or dying, so stem cells, they go there quickly, they run there, they replace it.
Okay.
They eat that one, it's called autophagy.
Yeah.
Okay. So that, and then replace it with the stem cells.
Okay.
That's first function, that it replaces that. Secondly, it divides again and again, 2 to 4, 4 to 16, 16 to 32, they start on dividing. But an age come when the stem cells were, not in that great number. That's why we become lines, wrinkles, age, diseases, and stuff.
Okay.
So this is the stem cells.
Interesting.
Now the researchers, we said this has been going on since Second World War. Okay, it's not today's thing.
Okay.
It's been from Second World War. But in early 1900s, they became very much, obvious, and they were doing research. In 1960s, two of the Canadian doctors, they were working under the microscope, and they found out few cells, the strange activity. All the cells were there. But they found these specific cells, they found that they went and they've replaced the damaged or diseased or dying cell. So they've taken the place of that. And then they started replicating. Okay. So they started this thing, and they said, "Oh my God, this is the basic block which can, rejuvenate yourself."
Okay, that's in
the
1960s. That's
in
when it's
1960s.
invented.
Yeah.
The rejuvenation of through the stem cells.
In next 4 or 5 decades, they were suppressing it. I don't want to name any organizations, but the pharmaceutical industry is such a big mafia.
Absolutely.
They wanted to suppress it. So any disease starts from cell, and cell replacement is stem cell. So if you replace the cell, so the disease is finished, whether it's diabetes, it's blood pressure, it's heart, it's brain, it's muscles, it's bones, anything. So they didn't want to do it. In 2012, ultimately, the research went so high that a Nobel Prize was given to these two people, that they have done so much
after
good work.
52 years of invention.
Yeah, I mean, so 5 decades.
God,
they were given. I think it was 2012. Let me check.
Yeah, that's like 50 odd years.
Yeah, so that's how it emerged and stuff. Still, there are things we said the stem cells. What they did is, first, they took the cells from the embryo. The embryo which is made in the tummy of the mother. But then what happened is, because Christianity, there were ethical issues with it. So what they did is, they said, no, we are not going to do it because it can damage the embryo, the baby, itself. Yeah. So they have put embargoes on it, they have stopped it, and they tried to stop it. Work was going on and on and on. Then it came as coming from the umbilical cord.
Okay.
So the cord is full of, means the baby when it is born, full of stem cells.
Yeah.
So that's where we get the stem cells from. And the third thing is, now I'll tell you the classification. There are different classifications, but our public should not know. They are not interested, but I'll explain a little bit in layman terms.
Yeah, sure.
So then these cells were taken from the umbilical cord of the baby, and they were saved, and they were obviously, and then they were transferred because they are totipotent. Means that they are the cells which, wherever you put it, say if you put it in eye, it will take the shape of the eye. If you put it in hair, in brain, kidney, gut, heart, they will take the shape of those cells and replace those cells.
But they has to be the same cells of that baby. They have to be same.
The stem cells are there like water.
Okay.
So if you put it in a glass, they will take the shape of the glass.
Okay,
if you put it in a plate, it will take. If you throw it down, it will flow. So these are called the umbilical cord cells, which are basic stem cells.
Okay.
So that started. Then later on, we have done research and stuff. So your own cells, your own body, in your bone marrow, in your skin, in your blood, in your fat, we have got stem cells, but they're diminishing with age.
Yeah.
As we age, they become lower and lower and lower in numbers.
Okay.
So they cannot replace all the damage, because all our years, years we have been working and stuff, the damage is going on. Say they replace, so they are depleted almost. So there are very few.
Okay.
Then what happened is, so we can take the stem cells from your body, from your skin, from your fat, from your blood, from your bone marrow, and we can replicate it, we can grow it, we can, in a culture similar like our body, and we can isolate, culture, regrow, and put it back in your body.
Okay.
So
Right.
that's how it works. So in your hair, in your kidney, in your eyes, we will come to all these things in a minute.
Yeah.
So what happens is, but the FDA put restrictions on it because there are certain things they say no. Once you take it out of the body and then you regrow it, then it is called or it is classified in the drug community. So it becomes a drug then. So it should be regulated by the FDA.
Why? It's your own body. It's your own cell.
Yeah, this is their legislations and stuff. I do not want to go into that. There's a big chapter about it. We can discuss something else. But to understand, so these are the stem cells. Then what happens is there are cells which are. So these are different types of cells which are pluripotent, which are induced pluripotent. Induced. These cells which we talked about is induced. What we do is we take it from your body, and we culture it, grow it. The rest of the things we discard, and we grow it in very hygienic conditions. At least BSL-3 or BSL-4 lab is required.
Okay.
So we grow in that, and then we put it back into your body.
Dr. Q, it's a really, really fascinating kind of discussion going on. I mean, to be honest, I'm not medical, so I don't really know anything like this. And it's really interesting to know how stem cells work and what's involved in those kind of things. So I'm really enjoying this conversation, and we will be right back after a short break, and we'll discuss further with Dr. Q. Welcome back. So we had a really good conversation at the first half of our program. Let's continue that discussion with Dr. Q. Dr. Q, really fascinating to know about stem cells. I had no clue about it, so I'm really interested to know a little bit more about it. Let's go into 3 different diseases we have: diabetes, Alzheimer's, and kidney problems. Let's start with diabetes. I am pre-diabetic as well, so I would really interested to know how these stem cells work. There is type 1 or type A or type 2, I think, diabetes. So if you can explain how they work and how stem cells actually can help to eradicate the full diabetes issues in your body.
Right. As I explained, that regenerative medicine stem cells are the basic blocks of the body which rejuvenate your disease, damaged or dying cells. So diabetes, let's take one by one. So any disease from head to toe, any disease, so that will be replaced, can be cured with the stem cells. The early stages were, they were curing cancers and stuff. I would not go into that in the moment. As you said, we are limited with time and limited with the topics because we have to cover. Diabetes, you asked me, diabetes, there are basically there are 2 types of diabetes, but now there are more types of diabetes. There's type 1 diabetes and type 2 diabetes. Type 1 diabetes is called insulin-dependent diabetes. And
where you have to get injections,
Yes.
insulin injections you have to do.
And type 2 is non-insulin dependent diabetes.
Where people
mellitus.
take metformin.
Yeah, different medications, okay? So, now what is type 2? Type 2 diabetes, basically now, I'll go according to whatever the current legislation is, that it is because of your body's body response to insulin becomes resistant.
Okay.
So your whenever you eat carbs or anything, your insulin spikes up. So insulin comes and it pushes it into the cells.
Okay.
Okay. So that is totally, they take it out of the blood. That should not be in the blood, because in the blood, if it goes into brain, it will cause problem. It will goes into the kidney, it will cause problem. It will go in all areas. This will cause problems. So what they do is, this is called type 2 diabetes. The comorbid factors are basically if you are obese, you're fat, if you have got a lazy lifestyle, if your diet is processed food and you're not taking healthy diet, and no exercise, no nothing, lifestyle is very bad, stress factors, genetics, and so many things.
That's type 2 diabetes.
That's type 2. which people acquire later in the age. We say now if you go, me and you or our age people or any person would be going to doctor, they will do tests, they say, oh, you are pre-diabetic or you're diabetic. Okay, how did do they diagnose it? Because they say, okay, your blood sugar levels are that high. They do glucose levels, they do HbA1c.
Yeah, 3 months one, the blood test.
But the thing is, that's not an accurate thing to do. Basic thing is to do the hyperinsulinemia, free insulin levels in your blood.
How do you, what test is that?
Yeah,
how
that
do you
is,
do it?
we like other tests, same blood, same thing. So we assess that how much free insulin is in your blood.
Okay, what it's called? Sorry,
hyperinsulinemia. Hyperinsulinemia. So this is hyperinsulinemia. So what happened is, this is
probably I need to get that test done.
so you get diagnosed as
although I'm not that old, I'm only 30 years old.
It's not age, it's different factors, cofactors are there. Okay, now so this is type 2 diabetes, and type 1 is the diabetes. They are all metabolic diseases, okay?
Sure.
So type 1 is the disease where your beta cells of Langerhans, which produce insulin as soon as a baby is born, preborn or post-born baby, their own autoimmune system that attacks your pancreas and the beta cells of the Langerhans, and they destroy them. They think that they are not my normal thing, so they destroy the insulin producing cells. When there's no insulin, so you cannot produce insulin. That's why you are being given, preformed insulin in the form of injections.
That's fine. But I think for an audience and for a layman person who don't understand all this kind of medical kind terminology, my question would be for you is that how stem cells can eradicate diabetes, type 2 diabetes, for example, or type 1 diabetes from the body, or it can or it cannot?
Now, that's what I'm saying. So there were basically two major types. Now they call Alzheimer's as type 3 diabetes.
Oh, so Alzheimer's is a part of the diabetes extension.
They call it now type 3 diabetes.
Okay.
If you go on AI or Google or DeepSeek or ChatGPT, you will find out type 3 diabetes is Alzheimer's.
Okay.
Because high levels of sugar in your brain that causes your memory problems, that causes your concentration problem, that causes so many other problems, dementia.
So it all actually affect by the diabetes,
because
okay.
It's a closed system, so the blood goes everywhere. So if the blood is not gone into the cells and consumed, your lazy lifestyle, so that will go and be stored into the liver, and liver will push it into in the form of glycogen, and it will be stored. You become fat, about visceral fat, like I've got. So that's how you become fat, and that is one of the comorbid factor for type 2 diabetes.
So let me explain it to you. You mentioned that how you are, but are you diabetic?
No, I'm pre-diabetic. But what happens is I've had COVID vaccine complications.
Oh, okay, that made it worse.
Then I was quite crippled and stuff. 3 months I was paralyzed and stuff. I would not go into that anyway. So now I'm going to start this program with whole of the population. So I will get back into these things. So what happens is, if you control your diabetes, you can recover. Previously they said that diabetes is not a treatable disease, not a reversible disease. Now I'm saying it very clearly with the conviction that diabetes is a reversible condition.
How?
Because I can tell you so many things. Stem cells, you said it. So stem cells, what happens is they go and replace the cells of the beta cells of the Langerhans in the pancreas, and then you start producing insulin, or the resistance is finished. Okay. Autophagy, that is, we can produce even stem cells. Just remind me, how can we can produce stem cells by our own efforts. you can produce your stem cells, you can activate them. You can
right,
increase
okay.
them.
How do you do that?
That is intermittent fasting. So if you do
Yeah,
the fasting,
brilliant. I was going to come. What we'll do is we'll take a very short break right now, and we'll come back to intermittent fasting, and because I have personal experience with that as well, and then I'll share with you. So, audience, let's take a very short break, and we'll come back in a couple of minutes. Welcome back. We were talking about diabetes, stem cells, intermittent fasting, diabetes type 1, type 2, and type 3, which is Alzheimer's. Let's continue our talk with Dr. Q. Dr. Q, before we went to a break, we were talking about intermittent fasting. So I wanted to give you my own personal experience as well. I had a pre-diabetic, kind of results for the last couple of years, and the doctor has advised me to take metformin. I've been very reluctant. Yeah, but I started intermittent fasting, I lost weight, and my diabetes come back normal. So I'm still not on metformin, but however, I'm trying my best to deal with things as I can with exercise, with less eating carbs and intermittent fasting. Personally, I think one of my friend has been diabetic for many years, and he's been taking metformin, and at the time he's been advised by the doctor that now you have to take insulin, and he was really scared about having injections and having insulin, and he started studying about diabetes quite a lot, intense. He's a very kind of guy who actually reads a lot, and you know what, he actually started cut down on carbs totally, and he started eating proteins, no sugar, no carbs like rice and chapatis and all that kind of stuff. Yeah, he quit, and he is not even on metformin now, and no insulin, no medication, and his diabetes is perfectly normal. What do you want to say about that?
Right, I can say it with conviction. Up until now, the protocols and the guides in our, in the world diabetic associations, with the Harvard University, with all these things, is that this is a non-reversible. So it's irreversible disease. You cannot reverse it. But I'm amongst those people who have always challenged it, and we have got substantial evidence to prove that diabetes can be reversed. Now, especially the type 1 now, if you see, type 2 is very easy because you can do it yourself by just lifestyle changes.
Yeah, exactly.
Like you said, I'll discuss first your style, because when you stop carbs, when you take the carbohydrates, so they are ready-made sugars. So your glycemic index, that goes very high. When the glycemic index goes high, so what happens is your body releases insulin in response to that. So short spikes are okay, but if you're consistently having spikes, and pancreas is consistently, like adrenals and stuff, cortisol levels are high, so you're in stress, the cortisol levels are high, your sugar levels are high, so adrenals, they get tired. So your pancreatic cells, they get tired. And they can no more push the glucose into the cells. Okay. So that goes remains in the blood, and wherever it goes, say it goes to your peripheries, it causes peripheral neuropathy.
But if you walk or if you do some exercise,
I'm coming to that. So if the same blood, it goes to every part of the body, it goes to brain, it becomes Alzheimer, it goes to kidneys, it becomes diabetic nephropathy, and if it goes into the eyes, it's called diabetic retinopathy. Retina, so it damages those things. Type 1 diabetes, this could be done very easily by yourself. I can explain all these things to you. Look at the type 1, there was no cure at all. So people has to go for insulin injections, babies, they start from that. Now recently, in last month, the China has published, there's so much research work going on. So for 3 consecutive years, they have put the stem cells into the rectus muscle. You know, there's muscle, this muscle which is in the belly, you know, like six packs and stuff. So there's a rectus muscle. So they put the stem cells in the rectus muscle. Beneath the skin, there's a rectus sheath. And in rectus sheath, both sides, anterior rectus sheath and posterior rectus sheath, in between is a rectus muscle. So they put the stem cells in the rectus sheath. For the last 3 years, they have maintained the blood sugar level very on the same level.
And that is depending on what you eat, or you can eat whatever you want?
Eat whatever you wish to.
Wow.
Yeah. So this has been published now. This was in China. I can send you all the details. You can Google it.
So can you do that kind of treatment?
Yes, we do. Yes,
so what's involved in that? I mean, we've got audience. I mean, I'm sure, you know, especially in Asian community, there are so many people who are diabetic, and they would love to hear that kind of treatment.
Faisal, let me tell my audience, you know, I'm starting my own program, inshallah, very soon. And I'll tell you how to reverse your diabetes, how to reverse your, you know, Alzheimer's, how to reverse your kidney problems, and everything. I can reverse it. I can bring you back to your shape and everything. People, they can't lose weight. They will see me losing weight. And then they will do it themselves, and they will find out. And there's no hard and fast things.
Dr. Saab, let's start from me. I will be your example, you know, testament.
I'll be there, you know, because I'll have to prove that I've lost my visceral fat, you know, which is the belly fat. So if all the people, the audience are with me, you know, they will be giving me feedback.
But I think this is really important what you just said about that muscle. I mean, what
rectus muscle.
A rectus muscle here. And you implant something in there.
Stem
is
cells.
It like a stem cell?
Yeah.
So taken from your own body.
Yeah.
And then injected in there.
Yeah.
And that actually helps you to regularize your diabetes.
Yeah,
regardless of what you're eating.
Regardless of what you eat. The same thing is with type 2 diabetes.
Right.
If you put, this is a job of an interventional radiologist. If you can put the stem cells through, you know, interventional radiologists, they watch it on the screen, and they go inside and they put it into the pancreas where the beta cells are. So your diabetes is completely reversed, and you are no more diabetic. You eat whatever you wish to.
So that it sounds like very easy thing to do and reverse the diabetes. Why it's not on NHS? Why the doctors are not actually doing that?
There are so many things. That's why I said, you know, there are restrictions on it, because we are doing our clinical trials and everything. Everything you do is the pharmaceutical industry and the FDA and the other place, you know, they put hurdles into it. Because just suppose, only one metformin or whatever diabetes drug, if that is abolished, I don't know, there's a statistics, they say
millions and billions of
$3 trillion.
$3 trillion, yeah, exactly.
So can you imagine $3 trillion lost for pharmaceutical industry? Would they leave it?
But that will be replaced by this therapy, wouldn't it?
Yeah.
Because obviously
Absolutely.
it will also cost.
I can do it.
It will also cost. Yeah. Okay, just coming back to this point, I think it's really interesting and important point that can you get this treatment done privately?
Yes, of course you can.
And what it costs and what it
different
involves?
Costs at different places. You can get it in China, you can get it in here in Germany. You can get it all over the Europe. You can get it in Denmark, in Norway. You can.
So
get it
is very
Spain.
Common. It is very common, and people are actually getting benefit of
course,
being diabetic and then not diabetic because of that treatment.
Excuse me.
Is it available in the UK? Can you do that treatment?
Absolutely, yes.
Okay.
They are available, but this is not spreading. You know, they are not giving it to public. Because if public, then the pharmaceutical industry, who controls the Harvard University, their publications and everything, recently about the COVID-19, the spiked virus, you know, so much things, you know, and this is now proven that that was the cause of so many problems, and that was not the right thing to be done. But we all had this vaccination, and I suffered from the complications of that vaccine, and so many people died with it.
Right.
Young people, young boys and girls, they're dying sitting watching TV or something, having heart attack, myocarditis.
Because of the COVID vaccine.
Stroke,
side effects.
Brain hemorrhage. This is because of the spiked virus, The COVID virus is a spiked virus, like spikes there. So they are dying, and this has been now proven that this is the cause. Now, excuse me, I'm not feeling well, but so they are suing the company. Pfizer has recently been dragged into these things, and into the and they are in big trouble.
So okay, so if I want to get that treatment, let's say from you for stem cells, I mean, I can't remember what you said. it's all medical, terminologies. Can I do it? Is it legal in United Kingdom?
Absolutely.
Is it allowed?
Yeah. What I'm doing is because I'm trying to move out, because here there are so much restrictions into it.
I think we're going to just take a very short break before we conclude our program for tonight. So let's take a short break and we'll come right back. Welcome back. We were discussing about the diabetes, Alzheimer's, stem cells with Dr. Q. Let's get our communication or conversation continued. Dr. Q, it was really interesting to know so many things which I wasn't probably aware, and I'm sure the audience weren't aware as well. Let's in the last segment, let's talk about kidneys. So how stem cells actually help to resolve the issues if you have any kidney problems?
Right. Now, as we said that, let's take diabetes, okay? Diabetes, the three major complications of diabetes. If you ask anyone, a medical student or a doctor or something, what are the three major complications of diabetes? They will say diabetic retinopathy. So the retina, you get retinal detachment.
That's right, yeah.
Diabetic nephropathy. Nephro means nephron, kidney. So diabetic nephropathy. And diabetic peripheral neuropathy. Okay. Peripheral means in the peripheries, not in central. So you must have heard that, the foot, you have to take care of the foot because there's no sensation. If there's a damage, it gets black because the blood supply is not so good. It becomes black, it becomes gangrenous, then you have to cut it.
Sure.
And people you must have seen or heard or, seen the images and stuff, so they keep on cutting and it comes up and up and up.
Sure.
So this is called. So the second big thing, and obviously the third, the type 3 diabetes, which we call it Alzheimer's, because high levels of insulin causes dementia, Alzheimer's, Parkinson's, these kinds of things.
What about kidney?
That's what I'm coming to. So kidneys, because there's so much sugar in the blood, and the blood is filtered through the kidneys. Okay. So kidney retains the main basic things, not to waste anything which is important.
Okay.
So sugar is very important for you.
Okay.
This is like a pricey thing,
Yeah.
So anything which is pricey, they will try to control, like proteins, like carbohydrates, like fats or anything. Anything which is dangerous, like ammonia, like anything, heavy metals, like chemicals. So they will try to throw it out through the kidney, filter it and throw it out of the kidneys. Okay, that's why our ammonia level, when kidneys can't function properly, they can't push out the ammonia. They can't push the sugar out, so they become damaged. The small blood vessels which is supplying the kidneys, the kidney tubules, renal tubules, they are called, the nephrons. So they become damaged.
Okay.
When they become damaged, you get a renal failure, and then you go into acute or chronic renal failure. Then you go for dialysis because your kidneys cannot throw it out. So you
have to drain the whole blood.
Put it, connect it to the machine. It goes and machine takes those heavy metals, those chemicals, and all the poisons and stuff from the blood, and the blood is given back to your body.
Okay.
Now, slowly and steadily, so you are once a week on a dialysis, then you are twice a week, then you're 3 times, and then they say, okay, now your kidneys are 5%, 2%, 10%, whatever.
Yeah.
So they ask you to please arrange a donor. Okay, So
Yeah.
a donor, then tissue
to,
matching,
to do the kidney transplant.
So if you can't find the donor, it's very difficult. So first blood is preferred, but it's very difficult for first blood even to take the kidney, because people, they believe that,
I have two kidneys and that's it. I'm not giving my kidney back.
Absolutely.
Yeah.
So that's how they think. So they ask you to bring a kidney so that they can transplant it. Now the good news is that you don't need to go for kidney transplant.
Okay.
All the people who are on dialysis, who have got diabetic nephropathies and stuff, they can come to us and we can guide them, we can advise them, and we can reverse this process. And the kidneys having stem cell treatment in very near future, it's going on now. But very near future, it will be available to everyone. So you don't need to go for a kidney transplant anymore. Same is with the joints. Say if your uncle, your auntie, your mother, your grandfather, grandmother, they've got some these problems, and they've been asked.
That's quite fascinating, actually, the whole conversation about stem cells and how you actually put it forward, that, how easy it is to replace, the kidney issues and the diabetes issues and everything like that. And I've known lots of my family friends who are actually on dialysis, and they are going every week or twice a week to do the blood transfusion and changes. Dialysis it's called, the dialysis, and they've got high diabetes ratios. Why I ask question that why NHS is not looking to invest into stem cells, where they can save lots of money by just doing dialysis, and by treating diabetes with providing so much medication to the whole population. Why they are actually reluctant to actually invest more into stem cells, where they can actually save lots of money? I just asked that question.
Not everything is crystal clear, okay? There are certain legislations which are, I don't want to go into that, whether they are put purposely.
But those legislations needs to be changed, isn't it? I mean, the legislations are made for the betterment of the population and the industry.
But they will look at it from that perspective. Say, I'm a pharmaceutical industry, okay?
Doesn't matter. I mean, if you are making money now, that's absolutely fine. But
you're
making money,
you're putting your foot on my throat, on my jugular veins. So
well,
if I cannot sell my medications,
okay,
if I cannot sell medications and your foot is there, what should I do? I'll cut your foot. I'll throw it away. So this fight is going on. This fight is going on between pharmacy, and they put it sometimes to clinical trials. They put it to so many things. It has to be 100% safe. This has to be this and that.
So
many things. They put hurdles into it so that to delay it as much as they can.
But if Germany is doing it, if Europe is doing it, if China is doing it, if there are so many other countries is doing it, then I ask that question to the legislators of this country, that why they are not looking into this.
You need lobbying. The politicians, they have to do lobbying for it. And politicians, I'm very sorry to say, they've got their own interests. So unless the legislation has been changed, unless you motivate you can write, anybody can write to the MP about it. And if you get 1 million or something, I don't know, signatures, it will have to be brought into the parliament. So yes, I'm very happy to go and present everything with statistics, with everything. I've got this much data to substantiate my claims that these are reversible, especially and elderly now, not even elderly. This memory problem, concentration problem, Alzheimer's, Parkinson's, ADHD, autism. These are all because of these things. So we can
reverse
do so much for that.
Brilliant. Dr. Q, thank you very much for, I think we're running out of time today, but I will definitely do another session with you on aesthetics, how you can make people beautiful. And we will do that in the next episode. Audience, I hope you enjoyed today. Dr. Q has a wealth of knowledge, and what I've learned today is immense information about diabetes, about stem cells in particular. And I hope you enjoyed it as well. As we say always in this program, obviously we are independent. We bring our guests and have their opinion and give our opinion. And
But
that's what
one
it
thing,
is all
you
about.
know, anything you take, consult your GP first, okay?
Yeah, of course, you take your specialist advice, consult your GP on anything or any medication.
This is just
you are
educational
taking.
things.
This is an educational thing, as Dr. Q just mentioned, and we will keep bringing awareness, different guests, experts, and give you some more information. This is my third program. I'm trying my best. I've never been an anchor, and I've been a banker, I've been a politician, but this is first time I'm doing this thing. So please bear with me. I'll keep trying my best to bring as much as informative topics to you. This is also a part of business. There is lots of healthcare business going around, care homes, stem cells, and private, GPs practices and everything like that. So it's all part of learning. So thank you very much for listening today. Look after yourself and people around you. Goodbye till next week.